Right, and this is some talking point that, you know, the Obamacare people have been, Obama misstated what happened to that guy with chemotherapy. In fact, he got his chemotherapy. He didn't die because of rescission. Rescission is worked out. It's very rare. Once you've had the policy for 2 years, it's your policy regardless. You pay the premiums. The company cannot cancel it unless it ceases doing business entirely. And everybody with pre-existing conditions is supposed to have access by federal law to an insurance policy in every state in the country. Now, some of the state pools are not accepting them because the states aren't funding them adequately, but why would it be any different if the state is running the entire insurance plan? It's still not going to fund it adequately.
And for instance, here in Colorado, made a front page story in the Denver Post as if this is news. We have a high-risk pool called Cover Colorado. All of us with insurance pay extra, a few bucks extra that goes for this high-risk pool. And if you have a pre-existing condition, they cannot deny you for it. You can get private insurance through this high-risk pool. It seems to be working pretty well in Colorado, is it not?
I guess I don't know the answer to that. What I understand is that it's still expensive, I think, to get into it. In Cover Colorado, you still have to pay for your insurance, don't you?
Well,
yes.
yeah, like everybody else.
Right.
But if you're under $55,000 a year, it's a heavily subsidized premium. You get a good deal given your medical expenses at Cover Colorado. Yeah, it's expensive. Healthcare is expensive. Somebody's got to pay.
Right. I agree with that.
Talking about somebody who's got to pay, let's take a look at this third and final wonderful award-winning video from the Independence Institute. Here's the last one.
A recent National Public Radio piece on Obamacare substituted the words public plan with public airplane to illustrate the wonders of government-controlled health care. This no-frills government air wouldn't offer meals, movies, or pillows, but NPR claims they would get all of their passengers to Healthyville, just like the private airplane. Really? Here's a public airplane. It's subsidized by taxpayers and not subject to the same rules as a private airplane. The private plane has to pay its own way by attracting customers and providing good service. So which plane will fill up first? Duh. Since government air must take everyone at the lower cost, they'll quickly start to run out of money, and they'll have to cut their costs. Pilots, let's start by slashing your pay. Sorry, old-timer, you've already been to Healthyville. Critically sick person? You probably wouldn't have survived the trip anyway. Want to switch back to the private airline? Sorry, your employer chose the government air public option, and the private airlines are no longer allowed to issue individual tickets. Looks like the public option is now your only option. We hope you enjoyed your flight on government air.
Did you draw the cartoons as well? That's a very attractive flight attendant.
Yeah, I had
on the public airplane.
Yeah, I had some say in that one. Now, one of the great lines that I'm hearing from the president, I've heard great things from presidents before. You know, I'm not a crook. I'll read my lips, no new taxes. I did not have sex with that woman. And now I hear one that is...
We're going to find the weapons of mass destruction.
We're going to find the weapons of mass destruction. I think I'll add that one in. And I hear, if you like the health care plan you have now, you can keep it. And I think in the short run, that's likely true, but aren't we going to have an unfair competition where this government plan with all the subsidies are going to slowly take more and more customers, and then we're going to run into that problem?
You've described a public option there that I would not support. I think that what a public option needs to do is it needs to be not subsidized. It needs to be run on the money that comes in from the people who choose that public plan, and it needs to work on the same rules that private plan, and maybe then the private plans will be able to compete. According to the way you think, they would definitely be able to compete because the profit motive would give them more incentive to do a better job than a public plan, and so then that would be fine. I just want the public plan there to provide this incentive for competition. So, but I don't think it should be subsidized because I think that would, if it was subsidized, then it would be an unfair advantage.
What happens to the private companies as a public option starts taking hold?
It
depends on what the public option is.
Well, as the House bill stands right now, they are dead meat because basically the House bill has all kinds of things that says, well, you can't issue after this date, you can't issue new policies to individuals, and you have to pay extra taxes and so forth. So the public plan's not going to be taxed, the private plans are going to be taxed. The feds are going to tell them what kind of insurance they can sell because we have this individual mandate and we all have to buy exactly what the feds say. Well, in Massachusetts, when they did that, they specified plans that nobody can make any money selling. And so the private companies all went away. What you get in Massachusetts now is all basically HMO-type public plans, local hospitals that get together and say you have this network. You have nothing like the kind of health insurance we get in the private market in the U.S. today.
What about what the senator says? All right, forget the Obama public plan, a public option.
Also, that's not like the House plan is not likely to be what turns out to be the final.
We
version.
don't know what's going to come out, but they're
If-
bad
if any-
ideas.
If anybody should
But
know
they
about
call-
what
they call it
what
They call it
legislators
the
can
House
do.
plan because they know the Senate is opposed to it.
Well, we'll see. But let's assume that we get something. We're tight on time. But let's assume we get something more what the senator is saying. Well, no, this is going to only those people who put in money. That's what it's going to use. There will be no subsidy. One, I don't know if that's politically
It's not going to
popular
happen.
over time or possible.
There's no way you can guarantee that it won't get subsidies and that it won't bend the rules to favor the government plan. You have to look at Fannie Mae and Freddie Mac. That's what happened to the mortgage market. Oh, they were just going to make it better. No, they wrecked it. Government can't be trusted in this kind of arena.
Is this the Fannie Mae and Freddie Mac of healthcare? If there's a public option,
Well, you can write a law that says the public option needs to stand on its own feet and isn't going to be subsidized. That's the kind of public option that I think makes sense. And you don't. I mean, you can't say that that kind of thing won't occur because you're trying to make an argument that it doesn't work. Let's say that that is the public option that we have. I think that would work. I think it would provide some benefits. That's the only kind I would support. If I was in the legislature, that's the only, or Congress, that's the kind I would vote for. And there's a lot of people who feel the same way. They understand the difference between subsidies and free enterprise.
You can't bind the next Congress, and there are people in Congress who don't understand that difference. And furthermore, we don't need more competition. We've got 2,000 insurers. Why not let people buy across state lines and do competition that way?
yeah. Talk about one of the things we could do. We've only got
It'd be
about a
so
minute.
easy.
Why is it in Colorado I'm not allowed to buy a policy in Kansas if it's cheaper if it doesn't have the same mandates? Why aren't we talking about that, which costs nothing? And by the way, the healthcare companies and the insurance companies hate that idea. They're going to make less money.
Well, would they say in Colorado, we said that a healthcare plan has to cover prostate cancer and mammograms. But in Kansas, they don't require that. So if the insurance company was out of Kansas, would they, and they operated in Colorado, would they still have to follow our rules? Because if they did, then I think that's a fine idea.
We'll see what happens. Hey, Senator, I appreciate you always coming over here and doing this. Do you think this thing's going to become reality?
There'll be something. I hope that it ends up being helpful.
I hope they're going to pass something. Are we going to despise it?
I hope it ends up being helpful, too.
See? There we go. Really good.
It's helpful. I like that. It's helpful, and helpful, and it's not going to destroy us. All right. If you want to take a look at those videos again, by all means, just go to the Independence Institute website. That's independenceinstitute.org. Check out our blog, patientpowernow.org. Listen for me late nights on 850 KOA. By all means, tell a friend, and we'll see you next week.
You jibber jab, bamboozle, nuka, noozle, bippity bop, she-gall. You jibber jab, bamboozle, nuka, noozle, bippity bop, she-gall. I mean, you keep on talking, but you don't know where to turn it off.